Trauma is a deeply distressing or disturbing experience that can have a profound impact on our mental health. It can result from various events such as abuse, violence, accidents, or natural disasters. When we experience trauma, it affects not only our emotions but also our thoughts and behaviors. Trauma can lead to symptoms such as anxiety, depression, flashbacks, nightmares, and difficulty trusting others. It can also disrupt our ability to regulate emotions and cope with stress. Understanding trauma is crucial in order to provide effective support and treatment for those who have experienced it. In order to understand how trauma affects our mental health, it is important to explore the polyvagal theory and how our nervous system responds to traumatic experiences. The polyvagal theory, developed by Dr. Stephen Porges, explains how our autonomic nervous system reacts to stress and danger. When we experience trauma, our nervous system goes into a state of hyperarousal or hypoarousal, depending on the nature of the trauma. Hyperarousal is characterized by an increased heart rate, rapid breathing, and a heightened sense of alertness. On the other hand, hypoarousal involves a shutdown response, where the body becomes immobilized and disconnected from the present moment. Understanding these physiological responses can help us recognize the impact of trauma on our bodies and develop effective strategies for healing and recovery. Now that we have explored how trauma affects our nervous system, let's delve into the internal family systems IFS model and how it can help us heal from past wounds and embrace the present. Developed by Dr. Richard Schwartz, IFS views the mind as a collection of different parts, each with its own thoughts, emotions, and beliefs. These parts can be protective or wounded, and they often interact with one another in complex ways. By understanding and working with these internal parts, we can uncover the root causes of our trauma and begin the healing process. Through IFS therapy, individuals learn to cultivate self-compassion, develop a deeper understanding of their emotions, and create a harmonious relationship between their various internal parts. This approach empowers individuals to release emotional burdens, heal old wounds, and ultimately embrace the present moment with greater clarity and resilience. In this section, we will explore the intricate connection between trauma and addiction, shedding light on how individuals can find a path to recovery. When someone experiences trauma, their nervous system often remains in a state of high alert, constantly scanning for potential threats. This heightened state of arousal can lead to overwhelming feelings of anxiety, fear, and discomfort. To cope with these intense emotions, some individuals turn to addictive substances or behaviors as a way to temporarily numb their pain or escape from reality. However, this reliance on addiction only perpetuates the cycle of trauma and further exacerbates the individual's mental health struggles. Understanding this connection is crucial in breaking free from the grip of addiction and finding lasting recovery. By addressing the underlying trauma and providing effective therapeutic interventions, individuals can begin to heal from their past wounds and develop healthier coping mechanisms. Through a combination of therapy, support networks, and self-reflection, individuals can embark on a journey towards recovery, reclaiming their lives and embracing a brighter future.